Wonderful. I want to check in with the patient. And I'm sorry, what is your name?
It's Ola. Ola Kabulova.
Oh, it's Ola.
Ola.
Okay. And doctor, did you hear something different? It seemed like you...
I thought she said Olga.
You thought she said Olga.
I couldn't pronounce her name, so I...
So, okay.
And you thought she said Ola.
And I thought she said Ola. So again, getting back to culture, something like a nationality, something like a name can be something very powerful. And how can we kind of stay open to all those possibilities? How do you spell it? What does it mean? Yeah. I want to acknowledge that I might mispronounce it, but Ola.
Ola.
Olia. Thank you for helping me pronounce that correctly.
Thank you for trying.
Thank you. Good. Ooh, Ben 2.0. Great. How did you feel about this initial interaction with the doctor?
Well, I was disappointed that she didn't want to know anything about my medicine, and it's a really good medicine, by the way. Mm-hmm. And so she was very dismissive and not really interested in that. You know, out of hope, she'll say, okay, let me look it up. Maybe there's something similar, you know, that kind of thing. And then, I'm sorry? Yeah. Or whatever, some interest. And then I was a little annoyed that she jumped on testing immediately and wanting to test, and she wasn't really interested in knowing more about the symptoms somehow, or what it means to me. Yeah.
Great. So
I couldn't connect with her.
You couldn't connect with her? No. Great, thank you. For sharing that. How can we help Dr. Chang improve with this specific patient? How can we help Dr. Chang improve? Maybe some folks we've heard from, some folks we haven't heard from. Yes, can we get her a microphone? Ademla, how are we doing with microphones?
Maybe she has to even pretend to be more sympathetic. Yes, tell me about her. You know that.
No, but I want to acknowledge that. I think. Go ahead.
And the patient has a real problem because from one side, she's losing weight, blood, incontinence, so maybe she has a real problem. From the other side, she came in, she's 36, she's a bit crazy, she's a music teacher, and we don't know what are her social problems, so maybe we can ask easily.
You mean I don't have a real problem?
No, you have. I said, we want to ask you about your real problem, maybe more.
Yeah, there's significant issues.
Yes, some social issues.
Maybe. And I kind of want to highlight something she said that kind of got a laugh. You know, that, we all are talking about fostering empathy, and that's certainly things that we want to do as human beings, is have more empathy. But sometimes we might just be having a bad day ourselves. Sometimes we might want to jump out a window and we've hit our limit. So then we do want to foster empathy. There was a word pretend. I don't know. If it's not in you at that moment, how can you at least help them understand that it's in you generally? Maybe not that day. So, we want authenticity, but we also want to recognize that at least the perception of empathy can have a significant impact. So, empathy, we can increase empathy. We can at least show interest in some of the things that we disagree with in terms of alternative medicines. What can she do around this resistance to testing?
Explain why.
Okay.
Have some more care.
Okay, so the resistance comes and...
Ask her from what she's afraid.
Right. Great. So exploring the source of the resistance. Why are you concerned? Why? Okay, you asked me, is it necessary? Why might it not be necessary? Somehow exploring that. I don't want to put words in.
She said something about her sister.
Yeah.
About her sister, we don't know what her sister has. Maybe there is something that makes her very afraid and anxious.
Right, which links back into psychosocial in terms of if they've had a direct experience with a family member who has a lot of experience around these issues, it might have been traumatic for her as what we call a secondary survivor, and addressing that might also help. Doctor?
I think as a generic thing, it's switching from but to and. If there are two differing views, the patient says something, yes, but, as opposed to yes, and we have other things we'll be doing as well.
Great.
So you don't dismiss the other.
Wonderful. We go from yes, but to we go yes, and. Wonderful. Let's go ahead and let's give Dr. Chang another crack at this one. Oh, okay.
I have to wait to applause to see if I do it
Yes,
well.
motivational applause. I love it.
Okay, maybe I turn the chairs. Okay. Hello.
Oh, hi, Dr. Chang.
Hi, nice to meet you.
Nice to meet you. Oleg Kabulova.
Okay, nice to meet
Nice to
you.
meet you.
Thank you for coming in today.
Oh, thank you very much for seeing me.
And how are you doing?
Not too good. I hope that you can help me. My condition's been getting... I had problems for a long time, but now it's really, really bad. And I have to go to the bathroom all the time, all day long, to the point that I'm losing, I teach piano and I'm losing my students because I can't go to the houses anymore. So it's a really big problem.
Okay, so maybe you can explain a little bit more about your symptoms. So it sounds like you're having diarrhea.
Yes, up to 7-8 times a day, easily. Sometimes at night, it will wake me up. But that doesn't happen very often.
And you said it got worse recently. Can you elaborate on that a little bit?
Yeah, so I went to Russia to see my family. I still have some family there. And I thought it's the food, or I got an infection or something. And actually I lost about 8 kilograms while I was there because I stopped eating. But never went away. I came back, and I'm still going to the bathroom. It's been 6 months.
Have you been able to regain that weight?
No, but that's not a big problem. That's actually okay.
Are you having any other symptoms other than the diarrhea, something that might be associated with the diarrhea?
Like what?
Any pain, for example, or discomfort, not feeling comfortable in your...
Yeah, lots of pain. I mean, I can cope. I mean, I can take the pain if the diarrhea goes away because that's what stops me from working. But the pain happens here, and if I eat, I'll have pain. And sometimes if I do nothing, I'll have pain.
Okay, so you mentioned work. So are these symptoms affecting how you work?
Oh my God. It's so embarrassing, Dr. Chang, but I had a recital with my students, and I was sitting in this beautiful dress on the piano. We're finishing, all my students are around, everybody's clapping, the parents are there, and I'm realizing I can't get up because I probably have a stain on my beautiful dress. I can't tell you how embarrassing that is at 36. So I don't know what else to say, but that's what's going on.
Is that the first time that's happened?
No, it has happened before.
Oh, it has. When has it happened? How many times has it happened?
Always at the wrong time. It's never a good time for that, I suppose. But
is that something that's only happened since your symptoms got worse, or is that something you've been experiencing?
Not before, only in the last 6 months.
I see. So
I just think I can't hold it, And so, by the way, I really hope you can prescribe this. I don't know if you know this, but this is Margantsovka. It's a really good Russian medicine.
Okay.
And I forgot, and when I was little, my mom used to give it to me, just a few drops in the, it's purple, few drops, the diarrhea stops immediately, and it's harmless. So my aunt just reminded me on the phone, and she sent me some, but I ran out. Can you prescribe this? Do you have something like that? It's a great, great medicine.
Yeah, well, this is in Russian. But what I'm going to do, if you don't mind, is keep it, because we might have something, that maybe not exactly this, but we might have something that's very similar that may help you. But if I can keep it and look into it further and then let you know,
so
then I will do that. Is it all right if I keep this then?
Yes, thank you very much.
All right. So that's something that we'll follow up on. Now, you said that your symptoms have gotten worse. So do you have any thoughts about why it might have gotten worse after all this time?
No idea. No idea. I mean, I don't think it's anything bad because I had it for 10 years and I had testing in Russia, blood tests, and I don't remember what else they did, but yeah. So I just don't know why it gone so bad now.
Right. Sometimes
how to stop it.
Yeah. Sometimes we have these flares where symptoms get worse or better over time. And sometimes it's related to multiple factors, issues. So sometimes it's good to reflect back maybe 6 months, leading up to the time that your symptoms changed, and maybe like thinking back about a year ago up to about 6 months ago and trying to think about anything that might have changed at all, whether it was diet or you got sick or you traveled or there were other things going on in your life?
I don't think so. I just went to Russia. Just okay, nothing bad.
Okay. So maybe you could think about that and then we could discuss it if there's anything that comes into your mind later on.
Yeah, but what do you think I have?
Well, I think it's important
because in Russia nobody's able to tell me what they say it's nothing bad, but I don't know what I have.
Well, it's something that you obviously have had for a while. But I think the fact that your symptoms are worse, that there's a change, and you also have experienced some weight loss, which you didn't have before.
And bleeding.
And some bleeding?
Yes.
Okay, so can you tell me about that?
I don't know what the word is. In Russian we say геморроиды. It's in the bottom.
Oh, hemorrhoids.
Yeah.
Okay, yeah, that's where the blood vessels get a little bit more swollen and they can bleed.
Yeah, but that doesn't happen very often, but it does happen.
All right. So the bleeding, the weight loss, worsening symptoms, you want to investigate or figure out why that is. And we want to make sure that we have the right diagnosis because we want to treat you properly. So some of the things that we do right now, tests that we would order is some blood tests, stool tests where you get when you go to the bathroom and you make sure there's no infection. Okay. And then also we look in the colon or the large intestine. We take a instrument where we look inside, so we directly see the colon and make sure there's no inflammation and no tumor or anything that could cause your symptoms.
I don't think. Can I think about that? I'm not sure I want to have that test. Well, is that necessary?
Now, have you had that before at all?
No.
Okay.
No.
Or do you know anyone that's had that?
Well, my sister, but I don't think it's necessary for me because I had this for a long time. I just want to get better.
No, I understand that. Do you have certain concerns about that test?
I mean, I think that I don't need it. I'm not sure if I need it.
Well, I think the important thing, and you could think about it.
And every test can be having problems, right?
Yeah, and I don't agree with doing multiple tests in patients, but I do think that we should think about or discuss more tests that may change your treatment management. So if we find something and it potentially could change your treatment, that's something we should really give some good thought to.
You mean like different medication?
Yeah, so for example, since your symptoms have changed, studies show that it could be due to something other than IBS, which is called irritable bowel syndrome. It could be done to...
I don't think I have that.
Yeah.
Because my sister has that, and I'm not, different.
Okay.
Different.
Well, it could be due to, your symptoms could also be due to a colitis or an inflammation. And the reason why it would be important to know that is because the treatment would be completely different.
Okay.
And I don't want you to keep going along with your symptoms and not giving you the appropriate treatment.
Okay, I'll think about it. But for now, can you maybe give me a different medicine? If hopefully you can find this, but if you can't, maybe something else.
Okay, we can do that. I think what we should do is finish our examination, do a physical examination. Want to make sure everything looks okay. I think we should discuss a little further about what we need to do, and then we could talk about treatment.
Okay. Thank you.
In a moment, I'm going to turn it over to Doug, and we're going to move towards closure. But just very quickly, expediently, efficiently, what did Dr. Chang do differently? What can we glean? What strategies can we glean from this case?
The resistance of the patient, she was more open.
She was more open?
That's right. And she gave her different alternatives. She explained.
She explained.
Completely empathic.
Alternatives. She explained. She provided alternatives. And again,
she kept the remedy in order to search for another one.
So the medicine came her way. She didn't dismiss it. She kind of embraced it. She took the energy. She said she would look up. She said she would explore it. And again, I just want to underscore another point that you made, that there was a lot of resistance coming from patient to doctor. And the doctor didn't match it with resistance. She just kind of let the energy flow her way, and kind of a yes-and situation. Good. So she kind of encapsulated, and let's give this role play a round of applause. One final round of applause.